If you had varicose veins for a long time, you may have noticed that you have these brown spots around your ankles. Now, this is known as pigmentation, and sometimes on its own, other than the fact that it looks a little bit unsightly and people may mention that you got a really bad tan around that area, it usually is quite harmless. But occasionally with these pigmentation, it can lead to a condition known as lipodermatosclerosis, whereby the skin gets thickened, hard, and even itchy. And for that reason, some patients will find that when they have this pigmentation, they hope that by treating these leg veins, they would get rid of the pigmentation because it's often due to your varicose veins. Now, the point I'm trying to make here is that sometimes with the pigmentation, if it's been there for a very long time, despite treating your varicose veins, the pigmentation may not go away, and it may reduce in some extent whereby it gets a little bit lighter, but this may occur over 6 months to maybe even 3 to 4 years before you actually see the lightening effect. Now, you can use energy devices to try to reduce the pigmentation in the area in the future, but if and when it becomes quite significant and chronic in that area, it can be quite difficult to get rid of. So it's always better to get it treated earlier rather than wait for that pigmentation to settle in and get worse.